Now, after highlighting how community health volunteers in Turkana walk long distances looking to find and treat children ailing for malaria and diarrhea and make referral for pneumonia cases, today we bring you the story of a family that lost their child in the hands of traditional healers and witch doctors, but the arrival of community health volunteers saved the life of their second child after they intervened on time and guided them to proper medication. Take a look.
At Kachaimeri village in Lorugum, Turkana County, is Akum Adeke at her home. She should be having 2 children, but her first child died. And as she watches her surviving child, she knows well what it means to have accurate diagnosis and proper treatment for a sick child. Diarrhea, malaria and pneumonia are the most common killer diseases for children under 5 years in Turkana County. Belief in witchcraft, lack of adequate medical facilities and an overwhelming level of ignorance among many residents of Lorugum had for a long time cost the lives of their young children. When this couple's first child fell sick, they had very little knowledge of what disease their child was suffering from. And given how popular traditional healers are here, their first call was a witch doctor. Their child did not survive.
Our child was 8 years old. He got ill in the evening, but we decided to wait until the following morning so we could visit a native doctor. Immediately we found the native doctor. Our child died even before he was treated.
Such was the general understanding by many parents with young children. Any illness would prompt a parent to seek the services of a witch doctor or a traditional medicine man. That, however, has changed thanks to the work of community health volunteers. Known to many here as village doctors because of what they do, the community health volunteers have filled the huge gap between high demand for medical attention and the low supply of medical personnel in Turkana County. With 79% illiteracy levels, Turkana is among the regions with the least penetration of essential services. Hence, the mention of community health volunteers here elicits hope and excitement among the population. Atekeitie and his wife Akuma Adeke say they almost lost their second child, who began to show symptoms similar to their dead child. But because they had already been introduced to the community health volunteers, they were spared another round of mourning.
Our second child was just a year old when he fell sick, but as the village doctor was moving around, he found our child having difficulties in breathing. She advised us to take the child to hospital. At the hospital, we were given drugs for the child. Ever since, the village doctor has been visiting us, and our child has been remaining in good health.
If you train these people on how to, first of all, recognize these relatively easily recognizable diseases, and then to teach them how to treat it, or to teach them that at this point you really need to go and get medical care at a qualified place. That makes all the difference.
Our people are now gaining access, or they are embracing the health services because of the knowledge they have received from the community health volunteers.
There are about 1,000 community health volunteers in Turkana County. After undergoing relevant training with a view to bridging the gap of inadequate health services in the most remote villages of Turkana, there is a growing acceptance of their importance in the community. Shadrach Miti, KTN News in the county of Turkana.